Types of eye removal surgery and their prosthetic restorations. Eye removal is often a difficult choice for surgeons, patients, their loved ones, and their follow-up healthcare team. This animation is to accompany and clarify the paper by Michael Hughes in the Journal of Ocular Prosthetics and aid your understanding of their differences. Let's see the parts of the eye. Here's a drawing of a normal, unaffected left eye. If we want to see inside the skin, you can imagine the entire contents from the side. Here's a sectional view we'll use to describe the orbit. The orbit is the bones surrounding the eye like a cone, and everything outside the eyeball itself. This is only the view before the surgery. Now we can see the eyeball, the muscles that move it, other supporting tissues, and the orbital bone that surrounds them like a cone. In the front of the orbit are layered tissues that help clean the eye, help it move smoothly, and protect it with fluids, nutrition, and sheltering eyelids. Web-like structures above and below the eye that hold it in place while it moves are called suspensory ligaments. The 6 eye muscles that move each eye begin from the back of the orbit and attach to the eyeball in front. They also help hold the eye in place. The muscles are wrapped in tissues that protect and allow them to glide at the best angles. One of these tissues is called a capsule because it entirely surrounds the eyeball and the muscles. Now we'll take a look at how these normal structures are changed in eye removal surgery, with what they're replaced, and how they appear after surgery. The first surgery we'll discuss is called evisceration. Evisceration is the removal of only the inside of the eye. Like removing the pulp of a pumpkin, the shell remains. The entire contents of the eyeball are removed, usually in one piece. The cornea and iris and entire retina and uveal tract are removed carefully, leaving behind the eyeball's white sclera and everything else inside the orbit. The eye muscles and the supportive web ligaments stay in place and are usually untouched. The only parts that are removed are the insides of the eye. The wet tissues in the front are still intact, and the tear system is unaffected. The eyelids are only spread to perform the surgery. To replace the size and weight of the contents, a ball-shaped plastic implant is placed inside the scleral sac. The selected size is as large as possible, allowing for closure over the front. The white sclera forms a tough covering to the implant, which is placed inside before the sclera is sewn tight, and it moves almost as well as before, moving with the other unaffected eye. Without touching the other orbital tissues, evisceration often allows faster healing. The implant moves well with the other eye, and the total volume of tissue in the orbit remains nearly the same. Only the inside is taken away. The prosthesis for evisceration is called a shell because it is so thin and rests over the sclera inside the socket beneath the lids. Often, the movement of the scleral shell is very good because scarring is minimal. The next more complex type of surgery is called enucleation. Though it's neither the simplest nor the most complex, it is the oldest and the most common type of eye removal surgery. Enucleation surgery is the removal of the entire eyeball without opening it. The enucleation implant is sized depending on its position in front of or behind the lining capsule. While types of implants vary, implants that allow tissues to grow into them, called integrated, increase the stability of the implant. By first opening all wet layers in front, severing all the eye muscles, cutting the optic nerve and all the blood vessels behind the eyeball, the sclera and all the contents are removed. Since this means getting behind the eyeball, it means stretching front tissues and invading the orbital tissues. Depending on the surgeon, the technique, and the patient's healing characteristics, this has a variable aesthetic outcome. The tear system may be displaced or damaged, the eyelids may be stretched or displaced, and the eye muscles must be accurately sewn over or directly to the implant. It must be secured in place as best possible. Sometimes a patch of tissue is sewn in front of the implant to help it stay in place. The prosthesis for enucleation is a little thicker than that for evisceration and is custom molded to the patient's socket. The last type of eye removal surgery, and the most extreme and least common, is called exoneration. Exoneration is the removal of the entire contents of the bony orbit. Everything, including the muscles and orbital tissue, is removed. The orbital tissue is not replaced, but the bone is lined with a skin graft. This rare surgery is for tumors that require doctors to be able to examine the orbit later. The prosthesis after exoneration is called an external orbital prosthesis because it usually rests outside the orbit and does not move. Since it's not behind the eyelids, it can be attached to glasses or glued in place and can be made of hard or soft materials. In choosing a procedure or technique, surgeons must be aware of all current findings and advances in techniques, and patients should be informed consumers of healthcare. The final prosthetic restoration depends on the surgeon and technique, the patient's condition and healing, and the ocularist. We hope this animation helps your understanding, and more information is available on the web.